Technicians at Henry Ford Health System's in-house lab are working around the clock to deliver test results to patients suspected of having the COVID-19 virus in a matter of hours.
Our focus right now is testing inpatients, critically ill patients, healthcare workers who've been exposed, and patients who are in the ED.
Linoche Samuel explains that focusing on a select number of samples allows doctors to respond to cases that are currently in the Henry Ford system right away.
The advantage for the Henry Ford Health System is that we can get these test results to our clinicians faster to triage these patients, especially ones who are in isolation. And then for our healthcare workers who've been exposed to identify, in fact, whether they are infectious, if they have the disease and have recuperated, whether they can still come back to work.
Henry Ford was the first hospital system in Michigan and one of the first in the country to run the CDC-approved test for COVID-19 in-house.
It was a really all-hands-on-deck effort to get this accomplished.
Microbiologists worked around the clock for 4.5 days to prove they could perform the test accurately and detect even extremely low levels of the virus.
This was accomplished because we have an excellent team of medical laboratory technologists who just worked all through the weekend to make sure that this happened as soon as possible.
If the tests aren't processed here, they have to be sent out, and the turnaround time increases from a matter of hours to a matter of days. Right now, they can process about 100 tests per day in this lab. Leaders are working on automating the process in the days and weeks to come.
Our goal over the next month is to ramp up to over 1,000 a day in order to be able to keep up with the clinical need.
The hope is that not only will Henry Ford be able to treat patients as fast as possible, but the lab will also help ease the burden on the public health system, which may become overwhelmed. For Henry Ford Health System, I'm Dana J.